New at 7, doctors at Trident Medical Center say their #1 trauma injury for patients is falls. One trauma nurse is trying to reduce those numbers and educate the community. Our Lauren Lennon found out why this was a personal mission.
My father is older. He's suffered 2 falls that have put him in the hospital.
An health situation isn't uncommon. According to Trident Medical Center's recent data, 47% of their trauma cases from January to July of this year were fall-related.
So we're thinking somebody who falls from height greater than 3 feet or falling from a roof. We do see occasional parts of that, but most of our falls are patients who just fall from ground level or maybe a step or two. You could have injuries to your brain, then you may have cognition issues. It may also be all the way up to life-threatening injury to the brain. You may have spinal cord injuries or spine injuries, even if it's just a fracture without a spinal cord injury. People fall and that could be life-changing.
So Houck and Dr. Jones are teaming up to help lower these numbers and educate people about the impact even a small fall could have on someone's life.
We'll do some education on falls prevention
And provide support through a new program.
Our pharmacists are going to be looking at medications, medication safety. Medications can play a very large role in falls. Our PT/OT team will be doing mobility assessments and making recommendations for our older adults. Our neurosciences team will be coming in and doing stroke risk assessments.
The main goal to prevent serious injuries.
Because once you fall, like I said, we'll do the best we can to avoid any secondary problems. But once you fall, you have the consequences of it, and you can't go back in time and change it. So prevention is key.
Working for you, Lauren Lennon, News 4.